Hello friends, our today's topic is tooth bleaching. So first we will discuss about different type of stains. We have extrinsic stain or intrinsic stain. Stains are accumulation of chromogenic substance of the external surface of the tooth, and because of the poor hygiene, ingestion of tobacco, drinks, and it is mainly localized. Then next is the intrinsic stains. Intrinsic stains are deeper stains, and because of the enamel defects, aging, ingestion of food and drinks, tobacco, enamel microcracks, tetracycline medication, because of excessive fluoride, because of severe jaundice, because of dental caries, because of aging, and because of fluorosis. If the fluoride concentration is more than 1 to 2 ppm, then it leads to the tooth staining. And because of metabolic alteration, because of defective matrix, improper calcification of the tooth, and these can be decreased by the bleaching. So now coming to the composition of the bleaching agent, first is thickening agent. The bleaching agent consists of thickening agent, which is carbopol, which consists of 0.5 to 1.5% of high molecular weight polyacrylic acid. So what is the function of thickening agent? Thickening agent, it increases the viscosity, which helps in the retention of the bleaching agent on the tooth surface. Increased retention will increase the bleaching time of the tooth, which leads to the whitening of the tooth structure. Then it increases the active O2 release with respect to time, which causes the tooth whitening. Then the next composition is carrier. Then in carrier, we use the glycerin or propylene glycol, which mainly maintain the moisture of the bleaching agent. Then third is the surfactant. Surfactant, it increase the wetting surface, which helps in the diffusion of bleaching agent into the tooth surface. Then next is the preservative. In preservative, we have methyl propylene paraben sodium benzoate. It prevents the bacterial growth, and it accelerates the breakdown of hydrogen peroxide by releasing iron, copper, and magnesium. Then next is the flavoring agent. It improves the taste of the bleaching agent, and it consists of peppermint, wintergreen, and saccharin. So this was all about the composition of bleaching agent. So next is the mechanism of the bleaching agent. We know that bleaching agent cause whitening of the tooth. So how it acts? As we know, when we take sugar, it reacts with the amino acid of the tooth structure, which leads to the Maillard reaction. Maillard is a non-enzymatic brown reaction which leads to the staining of the tooth structure. For tetracycline staining, which is the intrinsic stain, there is chemical degradation of unsaturated quinone type structure found in the tetracycline, which leads to the few colored molecule, and there will be bleaching of the tooth, also known as vital bleaching. In recent material, we have amorphous calcium phosphate, and we have CPP ACP, which decrease the sensitivity of the tooth structure and which decrease the demineralization of the tooth structure and helps in the tooth whitening. We know that tooth whitening is a easy procedure, and you can do it at home or in office of the dentist. It is the most common procedure done in cosmetic dentistry. It is very conservative and cost effective. It is ideal for the people who have unrestored tooth and no gum infection. Yellowish or brownish colored teeth behaves well with the bleaching agent. In office, bleaching is done by the dental professional who are trained dentist, and in-home bleaching can be done by patient himself or herself. Now coming to the various bleaching agent, we have vital and non-vital bleaching agent. For vital tooth, in office and at home bleaching. In office, we have power bleach or thermocatalytic bleach. For at home bleaching, there is night guard. For non-vital bleaching, there is in office and at home. And for in office, there is thermocatalytic bleaching, and at home there is walking bleach. So we will discuss it one by one. So for vital bleach, in office bleach, also known as power bleach, it consists of 25 to 40% of hydrogen peroxide. which is used for the tooth, and the curing agent will be light or the heat, and it causes the whitening of the tooth. In case of night guard, it is a home based bleaching technique in which patient can do it by himself. In this, the 10 to 20% of carbamide peroxide is used for 2 weeks, and it can be self administered, and it takes less time. There is increase in safety and there is low cost. Then bleaching over the counter consists of 3 to 6% of hydrogen peroxide, which can be self-applied by shield, strips, paint, and white dentifrices, and which can be used twice a day for 2 weeks. So this was all about vital bleach. In case of non-vital bleach, we can use sodium perborate in the pulp chamber or the root canal treated tooth to whiten the tooth. In case of walking bleach, we use 30% of hydrogen peroxide and sodium perborate for 1 week, which leads to the whitening of the tooth. Then next is the inside outside bleach. It is also a type of non-vital bleach in which we use the combination of the above two. After the non-vital bleaching, we delay the composite restoration for 1 week because it may hampers the coloration of the composite. So composite restoration should be done 1 week after the bleaching procedure. So this was all about bleaching different type of tooth. Now coming to the effects of the bleaching. As we know, bleaching causes the whitening of the tooth, but it has several side effects. First, it has effects on soft tissue. If the bleaching agent is fall on mucosa or the soft tissue or gingiva, it may leads to the burn, but it is reversible. So rubber dam should always be applied before the bleaching procedure. Then second is the systemic effect, in which there is GI mucosal irritation, there is palatal burn if there is any accidental fall, and stomach upset. The next is the effect on enamel. As we know, bleaching agent, it diffuse on the tooth structure, so it increases the porosity of the tooth, it decreases the protein structure of tooth, it causes the organic matrix degradation, and it modifies the calcium phosphate ratio of the tooth. Then it affects on the dentine. It decreases the micro hardness of the dentine. As we know, dentine is less harder than the enamel, so it decreases the hardness of dentine. It decreases the surface hardness and the wear resistance of dentine. So not only it causes the tooth whitening, but it may also cause some side effects. Cervical resorption is very common in case of non-vital tooth. So now, if you don't want to go for bleaching, you can go for the alternative treatment like microabrasion of the tooth, macroabrasion of the tooth. You can go for veneer or crowns, which may also cause the whitening of the tooth structure and which can maintain the shape of the tooth. So this was all about the tooth bleaching. Please like, comment and share, and comment down your queries in the comment section.